Okay, so we're done. Your gynecomastia is all finished. It's gone. Your burden has been lifted. And there's some things that you're going to want to know about that I can certainly educate you as to what's going to get you that final result that you want. The compression garment is there because that pressure that we keep on your chest will keep your skin stuck down to the underlying layers, so that it's less likely that you're going to have swelling and any kind of fluid accumulation. The garment should be worn for about 3, 4, maybe 5 weeks, depending on the extent of your gynecomastia. You're going to see some swelling probably, you'll see some bruising, but from the minute you're done, you'll always be smaller than you were. And that swelling can persist for weeks, 6, 7 weeks. The bruising is generally about maybe a week or so, and it really just depends on how much liposuction I have done. If it's just in the anterior portion of the chest versus up under the arms, or if I've done liposuction around the rest of your body, you're going to be bruised for a while. The compression garments will get a little bit loose, so you may want to adjust that garment, make it a little bit tighter over time. Sutures, if they do need to come out, generally come out in about 5 days or 7 days, really not that long. Most of the times I don't really use much sutures anyway. You can shower essentially the day you get home. Don't worry about it, get it all wet. You know, you can get your suture line wet, it's really not a big deal. As far as, let's say, exercise is concerned, everyone is always concerned about when they can exercise. I need you to take it easy, particularly for the first 3 to 4 days. You could start to do some light exercise after a week. I would avoid chest exercise for about 2 weeks. Alright, so at this stage, I've taught you a little about the recovery issues with gynecomastia, and I have a good friend of mine here who's going to be the essentially the human prop for me demonstrating some aspects of rolling and massage and the healing kind of process with gynecomastia. The area that you're going to get hard healing is generally in this region right here. The epicenter of gynecomastia is beneath the nipple areolar complex here. This is where the gland's going to be. This is going to be the empty space. This will be the space that fills up with water and fluid. So this is where the action is, over in this region. So hard healing basically means that I'll start to feel some kind of lumps and bumps down in this region over in this area right here. And we're going to get rid of those lumps and bumps in short order by treating it with a roller. This is an example of a roller. It's a typical roller. This one has 2 ends, bigger end over here, smaller rounder end over here. But starting about 2 weeks after surgery, essentially you're using this roller over this region here. And what this is going to do is squeeze out some of the water and the tissues and make sure that as that scar is remodeling on the inside, that it's nice and smooth. Now, it's not fluffy stuff. It's not this. You really got to push. You got to push hard, and you really got to work it. So you actually can feel a little lump on the ribs as you go over. That's a good thing. And you got to really work things in pretty much every direction. But it's important to know that the lymph nodes are up over here, so probably the best way is sort of up and lateral towards the lymph nodes and the axilla. But generally speaking, I don't care where you roll, as long as you roll it pretty hard. The other way to handle this situation is with your fingers. You know, deep tissue massage. Literally grab that firm tissue between your fingers and squeeze the heck out of it. I mean, you really got to squeeze it. So don't just, you know, it's not this. It's you got to squeeze it, and almost to the point where it hurts. And when you do that, that's a great way to help soften that scar. You can do it several times a day, 30, 40 minutes, all the better. In fact, if you can do it all day, that's wonderful. When you're driving, you can stick your hand up in your shirt and start to mash it. So basically, you roll it out until you get the result you want. And several times a day, and as much as you can, the more the merrier. I have a lot of people that actually pay their masseuses to do the rolling for them, or do the hand deep tissue massage. But this is what expedites the recovery. This is what makes it all happen. This is what really gives you the nice results and kind of softens things up tremendously.